Hi everyone, how are you today? Welcome back. And if you are new here, welcome to my channel where you can learn the real world coding experience. And this is Han, the coding expert. If you want to pass any coding exam to start your coding career, or if you are already holding a coding credential, working in the field, and want to learn more in order to advance your coding profession, then you are in the right place. I have recently received many emails from you who just passed the coding exam successfully and wanted to share your good news with me. Many of you failed the first time but didn't give up. Just dust yourself up and try again. They say mistakes are great opportunities because that is how we learn. Failure is what makes our success and achievement meaningful and unforgettable. I want you to really enjoy learning and don't think too much about the failure. Just do it and stick to your schedule. Do what you love, and the rest will follow. Today's topic is CBC, COC, CCS, and CCSP exam prep in 2021. The eye and anexa organs. You will have a chance to code surgeries and procedures that are related to the eyeballs, which I know many of you are struggling with. So, without further ado, let's get started. Before we start, I would like to go over the basic anatomy and physiology of the eye so that you should have an idea how the human eye works. The eye can be compared to a camera. The cornea is the transparent, curved front layer of the eye. It functions like a window that controls and focuses the entry of light into the eye. The pupil is the black circle in the center of the iris behind the cornea that allows and regulates the flow of light into the retina. The iris is a circular color structure that sits in front of the lens, which helps regulate the amount of light entering the eye. When there is bright light, the iris closes the pupil to let in less light, and when there is low light, the iris opens up the pupil to let in more light. The lens is an important part of the eye anatomy that allows the eye to focus on objects at varying distances. The anterior chamber is the space that is behind the cornea and in front of the iris. The anterior chamber is filled with a clear, watery fluid called aqueous humor. The last space behind the lens, the vitreous chamber, contains a thick, gel-like fluid called vitreous humor or vitreous gel. The superior rectus muscle is a muscle in the orbit, also called eye socket. It is one of the extraocular muscles. Its primary function is to elevate the eye and to control the movements of the eye. The inferior rectus muscle is also a muscle in the orbit or eye socket. It is one of the extraocular muscles, and its primary function is to depress the eye and to control the movements of the eye. The ciliary body is a circular structure that is an extension of the iris. The ciliary body produces the fluid in the eye called aqueous humor. It also contains the ciliary muscle, which changes the shape of the lens when your eyes focus on a near object. The sclera is the white part of the eye that surrounds the cornea. It is tough and fibrous, protecting the interior components of the eye from injury. The retina is a thin membrane which covers the inside back of the eye. Like film in a camera, the retina is a light-sensitive surface when images from the outside world come to focus. It contains the photoreceptor cells that send visual signals to the brain. The choroid, a thin layer of tissue that is part of the middle layer of the wall of the eye, between the sclera, white outer layer of the eye, and the retina. It supplies blood to nourish the outer retina with oxygen and nutrients. The optic nerve is also called the second cranial nerve, connects the eye to the brain. It transmits visual information, including brightness perception, color perception, and contrast visual acuity to the brain. Alright, that should be enough for the basic anatomy and physiology of the eye. I'm ready for question and case study. Are you? Let's do it. Question number 1. What is the correct CPT code to use for this procedure? Penetrating, keratoplasty, a faked eyes. Penetrating keratoplasty, or PKP, is a full-thickness, complete transplant of the damaged or diseased cornea with a donor cornea. The surgeons use specialized tools to cut the donor cornea so it is the precise shape and size necessary for the transplant. A similar tool is then used to remove the diseased cornea. The matching replacement cornea is positioned and sealed into place with very thin sutures, thinner than a human hair. When the sutures are complete, a protective shield will be placed over the eye. I put on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CPT book, if you look under the main term, keratoplasty, penetrating in aphakia, it will give you just one code, 65750. Your next step is to double check this code in the tabular list. And because 65750 is an identical, so I will show you its parent code. 65710, keratoplasty, corneal transplant, anterior lamellar. 65750, this is an identical, so it includes all the information from the cover above. 65710, except 65750 is for penetrating keratoplasty in aphakia, and this is the right code to use for this procedure. That said, the correct answer to this question is 65750. Question number 2. What is the correct CPT code to use for this procedure? Extracapsular cataract extraction bifocal emulsification with placement of posterior chamber intraocular lens complex. The purpose of your lens is to refract light rays that come into the eye to help you see. Your own lens should be clear, but with a cataract, it is cloudy. Having a cataract can be like looking through a foggy or dirty sky windshield. Things may look blurry, hazy, or less colorful. The only way to remove a cataract is with surgery. During a cataract surgery, your cloudy natural lens are removed and replaced with a clear artificial lens. That lens is called an intraocular lens, IOL. The surgeon looks through a special microscope. He or she creates tiny incisions near the edge of your cornea. The surgeon uses the incision to reach the lens in your eye. Using a very small instrument, he or she will break up the lens and remove it. Then they book your new lens into place. I will book on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CPT book, if you look under the main term, cataract, extraction, removal, extracapsular, it will give you a code range 66982 to 66984. Your next step is to check these available codes in the tabular index, and here what you get. 66982 extracapsular cataract removal with insertion of intraocular lens prosthesis, one-step procedure, manual or mechanical technique, irrigation and aspiration or phaco emulsification complex. 66984 extracapsular cataract removal with insertion of intraocular lens prosthesis, one-step procedure, manual or mechanical technique, irrigation and aspiration of phaco emulsification. You can tell the only difference between these two codes is that 66982 is for a complex procedure, and because the document indicates that this procedure was complex, so 66982 is the right code to use for this procedure. That said, the correct answer to this question is 66982. Question number 3. What is the correct CPT code to use for this procedure? Yet laser photocoagulation of retinopathy or premature 26-day-old infant born at 34 weeks. When a baby is born prematurely, the retinal blood vessel can grow abnormally. Yet laser photocoagulation uses the heat from a laser to seal or destroy abnormal, leaking blood vessel in the retina. I will put on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CPT book, if you look under the main term, photocoagulation, treatment, retinopathy, preterm infant at birth, it will give you just one code, 67229. Your next step is to double check this code in the tabular list, and here what you get. 67229, treatment of extensive or progressive retinopathy, one or more sections, preterm infant, less than 37 weeks gestation at birth, performed from birth up to 1 year of age, e.g., retinopathy of prematurity, photocoagulation, or cryotherapy. And this is the right code to use for this procedure. That said, the correct answer to this question is 67229. Question number 4. What is the correct CPT code to use for this procedure? Strabismus surgery with resection of superior rectus muscle. Strabismus, an abnormal ocular condition in which the eyes are crossed. For coding purposes, I want you to know the lateral rectus and medial rectus are considered horizontal muscle. CPT has specific codes for procedure performed on one horizontal muscle and two horizontal muscle, 67311 and 67312. The superior rectus and inferior rectus are considered vertical muscles. CPT also has specific codes for procedure performed on one vertical muscle and two vertical muscles, 67314 and 67316, respectively. The superior obliques had its own code, 7318. I will book on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. Since you already know, the superior rectus muscle is considered a vertical muscle, so in the index in your CPT book, if you look under the main term, strabismus, repair, one vertical muscle, it will give you just one code, 7314. Your next step is to double check this code in the tabular list. And because 67314 is an identical, so I will show you its pairing code. 67311 strabismus surgery, resection or resection procedure, one horizontal muscle. 67314, this is an identical, so it includes all the information from the code above. 67311, which is the pairing code, except 67314 is for one vertical muscle, and this is the right code to use for the procedure. That said, the correct answer to this question is 67314. Question number 5. What is the correct CPT code to use for the procedure? Repair of blepharoptosis by frontalis muscle facial sling. Blepharoptosis is the drooping of the upper eyelids, so blepharoplasty is a surgical procedure. It is performed to correct a drooping upper or lower eyelids caused by excessive tissue. It may be performed to correct a visual field impairment, or it may be performed for cosmetic purposes. I will book on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CBT book, if you look under the main term, blepharoptosis, prepare frontalis muscle technique with facial sling, it will give you just one code, 67902. Your next step is to double check this code in the tabular list. And because 67902 is an indelible code, so I will show you its pairing code. 67901, repair of blepharoptosis, frontalis muscle technique with suture or other material. 67902, this is an indelible code, so it includes all the information from the code above 67901, except 67902 is done with autologous facial sling. And this is the right code to use for the procedure. That said, the correct answer to this question is 67902. On a personal note, Medicare and some insurance companies may not cover it if it is performed for purely cosmetic purposes. That said, you should assign an additional diagnosis code for visual loss if it is documented, in addition to blepharoptosis, in order to obtain insurance coverage. Question number 6. What is the correct CPT code to use for this procedure? Excision of collagens 4 from right upper and right lower eyelids. I will book on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CPT book, if you look under the main term, excision, collagen, multiple, different lists, it will give you just one code, 67805. And because 67805 is an identical, so I will show you its pairing code. 67800, excision of collagen, single. 67805, this is an identical, so it includes all the information from the code above 67800, except 67805 is used when the procedure is performed on different lists. For instance, in this case, it is done on the right upper and right lower eyelids. That said, the correct answer to this question is 67805. Question number 7. What is the correct CPT code to use for this procedure? Trabeculectomy ab externo. This is a healthy eye with normal pressure. And this is the eye with glaucoma. Pressure builds up inside the eye. As a result, the pressure will damage the optic nerve connecting the eye to the brain, resulting in sight loss. Ab externo trabeculectomy (AET) is the most common surgical procedure to treat glaucoma. The procedure involves removing parts of the trabecular meshwork and create a new escape route for the aqueous humor. It allows the aqueous humor fluid to drain from the eye. I will book on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CBT book, if you look under the main term, trabeculectomy, ab external, in absence of previous surgery. In other words, the patient never had this procedure before. It will give you just one code, 66170. If the patient had this procedure before, then the scar from the previous surgery will make it harder for the physician to achieve an optimal result, but it's not in this case. Your next step is to duplicate this code in the tabular list, and because 66170 is an identical, so I'll show you experience code. 66150, visualization of sclera for glaucoma, definition with iridectomy. 66170, this is an identical, so it includes all the information from the cover above. 66150, except 66170 is for trabeculectomy ab external in absence of previous surgery. And this is the right code to use for this procedure. That said, the correct answer to this question is 66170. Just a friendly reminder that if you enjoy what you have learned so far and appreciate my time spent for this video, then you could please pause the video, click the like, subscribe, and share buttons below now to support my channel, and that'd be great. Instead of working overtime on the weekend to earn extra money or spending time with my family, I have used my valuable time to prepare for this learning video. As a result, I have no time left for myself. I'm doing it because I really want you to do well on the exam and also to have more confidence at work. Your comments about my videos and your continued sharing the good news right after passing the exam really inspire me and make me want to do more. Thank you so much for your support, and we should move on to the next question. Question number 8. What is the correct CPT code to use for the procedure? Removal of foreign body from posterior chamber using magnet. I will put on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CPT book, if you look under the main term, removal eye posterior segment, it will give you a code range 65260 to 65265. Your next step is to review these available codes in the tabular list, and because 65260 is an identical, so I'll show you experience code. 65235, removal of foreign body intraocular from anterior chamber of eyes or lens. 65260, this is an identical, so it includes all the information from the curve above. 65235, except 65260 is performed using magnetic extraction, and this is the right code to use for the procedure. That said, the correct answer to this question is 65260. Question number 9. What is the correct CPT code to use for this procedure? Subtotal vitrectomy with endolaser, panretinal photocoagulation. Panretinal photocoagulation, PRP, is a type of laser treatment for the eyes. It is used in people who have developed new abnormal blood vessels at the back of the eye, in the retina, or in the drainage system within the eyeball. The PRP laser treatment prevents abnormal new vessel on the retina and in the drainage system of the eyeballs from growing, and it also makes them less likely to bleed in the eyeball. This condition is called vitreous hemorrhage. I will put on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CPT book, if you look under the main term, vitrectomy with endolaser, penretinal photocoagulation, it will give you just one code, 67040. Your next step is to double check this code in the tabular list, and because 67040 is an identical, so I'll show you its parent code. 67036 vitrectomy mechanical pars plana approach. 67040, this is an identical, so it includes all the information from the curve above 67036, except 67040 is performed with endolaser penretinal photocoagulation, and this is the right code to use for the procedure. That said, the correct answer to this question is 67040. Question number 10. What is the correct CPT code to use for the procedure? Excision of 1.5 cm conjunctival lesion. I put on a short 30-second music while waiting for you to open your CPT book and find the right code for this procedure. Please pause the video and do it now. Alright, let's see how you did. In the index in your CPT book, if you look under the main term, excision, lesion, conjunctiva, it will give you a code range 68110 to 68130. Your next step is to review these available codes in the tabular list and hear what you get. 68110, excision of lesion, conjunctiva, up to 1 cm. 68115, this is an identical, so it includes all the information from the curve above 68110, except 68115 is for lesion over 1 cm, and this is the right code to use for the procedure, because based on the question, a lesion size is 1.5 cm, which is over 1 cm. That said, the correct answer to the question is 68115. Question number 11. Before we tackle this case, it is very similar to what you will see on the CBC coding exam. It is a multiple choice question, and if you have been watching my training videos, then you should know my backwards approach. Instead of reading the procedure report first, which you don't have enough time during the exam, and also you may or may not have a clue what you are reading or what surgery or procedure that they are doing if you are not a coder or never coded this type of surgery or procedure before. Not to mention, when you read a 1 or 2 page long of a procedure report with so many technical terms that you don't know, then you will feel nervous and panic, and as a result, you lose your focus during the exam. My backward approach is to analyze the answer first, and then read the procedure report after. This technique will give you an idea what surgery or procedure is performed by looking at the CPT code description, and I am the only one who tackle coding exam this way. Follow my tips and strategy. B and C have the same code, 15822, so they are in the same group. A and D have different codes, 15820 and 15823, so they are in separate groups. Now you know there are three codes that you need to look up in your CPT book, 15820, 15822, and 15823. Please pause the video and do it now. Assuming you already looked them up in your CPT book, and here what you get. 15820, blepharoplasty, lower eyelid. 15822, blepharoplasty, upper eyelid. 15823, this is an identical, so it includes all the information from the comparable 15822, except 15823 is performed with a sepsis skin weighting down lid. Follow my tips and strategy. You highlight the main difference between each CPT code, and when you're done, you should have an idea what your focus should be when you read the procedure report. Let's read it. A 60-year-old male has dermatochalasis on bilateral upper eyelids. A blepharoplasty will be performed on the eyelids. Based on what I just highlighted, this patient has dermatochalasis on bilateral upper eyelids, so a blepharoplasty will be performed on the upper eyelid. That said, the correct code to use for this procedure is 15822, blepharoplasty, upper eyelid. We can eliminate A and D from here. B and C still remain, and the only difference between these two answers is C had modified 50 for bilateral procedure, which B doesn't have. And based on the question, blepharoplasty will be performed on the eyelids in plural forms. It means that more than one eyelid. Also, an elliptical incision was performed on the left eyelid and the skin was excised. In a similar fashion, the same procedure was performed on the right eye. That said, the correct answer to the question is 15822, blepharoplasty, upper eyelids would modify 50 except for bilateral procedure. If you don't know anything about modify 50 for bilateral procedure, then you still can look at this code 15823, excessive skin weighting down lid, which C doesn't have. And based on the procedure report, there is no indication that excessive skin weighting down the lid had been excised, so B is not the right answer. So what's left? Still C. I hope you get it now. Question number 12. Follow my tips and strategy. This case is very straightforward. A, B, C, and D all have different codes. 669A2, 669A3, 669A4, and 669A5, so they are in 4 separate groups. Now you know there are 4 codes that you need to look up in your CPT book: 669A2, 669A3, 669A4, and 669A5. Please pause the video and do it now. Assuming you already looked them up in your CPT book, and here what you get. 669A2, extracapsular cataract removal with insertion of intraocular lens prosthesis, one-step procedure, manual or mechanical technique, easy irrigation and aspiration of phaco emulsification, complex requiring device not generally used in routine cataract surgery. 669A3 intracapsular cataract extraction with insertion of intraocular lens prosthesis, one-step procedure. 669A4 extracapsular cataract removal with insertion of intraocular lens prosthesis, one-step procedure, manual or mechanical technique, e.g. irrigation and aspiration or phaco emulsification. 669A5 insertion of intraocular lens prosthesis, secondary implant, not associated with concurrent cataract removal. Follow my tips and strategy. You highlight the main difference between each cyclical, and when you're done, you should have an idea what your focus should be when you read the procedure report. If you read the code description carefully, you can tell 669A2 and 669A4 are the same procedure, except 669A2 is for a complex procedure requiring device not generally used in routine cataract surgery. 669A3 is for intracapsular cataract and not extracapsular cataract removal. 669A5 is for secondary implant and not associated with concurrent cataract removal. Now you know what your focus should be when you read the procedure report. Let's read it. An extracapsular cataract removal is performed on the left eye by mainly using an iris expansion device to expand the pupil. A phaco emulsification unit was used to remove the nucleus. Irrigation and aspiration was used to remove the residual cortex, allowing the insertion of the intraocular lens. Based on what I just highlighted, an extracapsular cataract is removed with an insertion of the intraocular lens performing in one step. So 669A3 intracapsular cataract and 669A5 secondary implant do not apply. We can eliminate B and D from here. A and C still remain, and the only difference between these two codes is that 669A2 is for a complex procedure when a special device is used to remove the cataract, and based on the procedure report, an iris expansion device is utilized and documented, so 669A2 is the right code to use for this procedure. Having said that, the correct answer to the question is 669A2. If you go a real record, then I will also use modified LT for the left eye. I hope that you learned something new and valuable for coding today. That is all for now. Thank you so much for watching, for liking, and sharing this video. If you find this video helpful, informative, and easy to learn with its format, or if you have any suggestion, then please leave me a comment below just to let me know. I really appreciate it. Also, the more positive comments that you leave for me, the better chance for my videos will be reviewed by other people. So please continue to do so. Until next time, have a great day.